Pulkesh, can I start? Hello, Pulkesh. All right, I'll make a start. Um,
Yes, sir, please.
yeah, okay. Good evening, everyone. So, as a continuation of my lecture from previous session, we will be continuing with identification. And in the previous session, we had dealt with the determination of sex and various aspects related to intersex and other definitions of intersex and other medical legal issues. Okay, so today we'll deal with age, dentition, and if time permits, it will be related to stature also. Okay, so age in forensic medicine plays an important role. If you look at age, age is the time spent from the birth of a person to the current age or the current date. So it is date dependent, meaning when you're talking about age of a particular person, it depends on what day you're checking. And age is always recorded against a date. But if you take age, if you see age in a living person, it is always in a state of motion, in the sense it keeps changing with time. Okay. So when it comes to forensic medicine, age comes into medical legal picture under the following circumstances. So in fetus and infants, it is quite important. In children and adults, again, to make a distinction also, it is quite important. In dead persons, especially as a part of partial identification, it becomes very, very important. And skeletal remains, again, it forms a part of partial identification. So these are the important areas in which age becomes a medical legal issue. Okay, so we'll take it one by one at a time. So first comes fetus. In fetus, what we are more worried about is viability. I'll talk about in the next slide. So if you're looking at fetus, the age of the fetus from the time of conception, it goes on, and we can determine the age by different measurements using radiological techniques like ultrasound. So with the help of ultrasound, it is indicated here. Here's the pointer. So with the help of ultrasound, here you can see that they are measuring what is called as the biparietal diameter. Okay. So radiologically, with the help of ultrasound, there are ways to measure this biparietal distance. It is the distance between the two parietal bones, diametrically opposite distance, and this will be the largest diameter possible in the skull. And this diameter, there are measurements and there are formulas with which you can determine the length as well as the age of the fetus. And also there's another parameter which is the crown rump length. So it is the largest dimension between the head and the usually the buttocks. So here, since it is a fetus, you cannot differentiate the buttocks, so they take the largest diameter between the two opposite ends. So using the crown rump length also, we can determine the age of the fetus. Another most reliable method will be the femur length. So here the femur is identified using the ultrasound, and the distance between the upper and the lower ends of the femur are calculated using the ultrasound modality. So this again gives us the age. Okay. So if the fetus is dead, then crown rump length can be calculated using something called as fetometer. It is nothing but a board in which a scale is fixed on one end and the fetus is made to lie down like this, and the distance between the head and the heel is calculated, and this is called the crown heel length. Okay, so this will also be equal to the length of the fetus. Okay, so with the help of length of the fetus, how do we calculate the age? So there's something called as rule of Haas. So what is this rule of Haas? So it says that until the age of 5 months, okay, until the age of 5 months, the square root of the length gives us the age. For example, if the length of the fetus is 16 centimeters, let us say. So square root of 16 will be 4. So it will be 4 months. So the age of the fetus will be 4 months. And beyond 5 months, the square of the length gives us the age. Okay. So, sorry, not the square. The uh, length divided by 5 gives us the age. Okay. So, for example, if the length of the fetus is 30 centimeters, so length of the fetus is always measured in centimeter, and it is divided by 5, so it will be 6 months. Okay. So this will be the rule of Hess. So what it says is, if the length of the fetus is, uh, uh, let us say, to make it simpler, we'll consider 25 centimeters. For the sake of entrance, you just consider 25 centimeters. If the length of the fetus is less than 25 centimeters, just square root it and it will give you the age in months. If the length of the fetus is more than 25 centimeters, divide it by 5 and that will give you the age in months. Okay, continuing. So here we are worried about viability. What is viability? In India, viability is defined as at 28 weeks, it is termed, the fetus is termed viable. What does it mean? It means that the fetus can have an independent existence outside the mother. So it is the minimum age at which a fetus can have a independent existence outside the mother. So that is termed as viability. For India, it is 28 weeks, but there are instances where fetuses of 24 weeks have also been made viable in India. But if you talk about other countries, for example, developed countries like USA and Europe, their viability can be as low as 17 to 20 weeks also. So they have the capacity to make the fetus survive even at 20 weeks. So there the viability is different. But for India, the time period for viability is fixed at 28 weeks or 7 months. Okay. So how is age estimation done in case of children and adults? Okay. So moving on. So here we consider the features such as general physical development. Here we look at features pertaining to general physical development. So we assess the build and nourishment and development of the individual. Then we look at the secondary sexual characteristics. Okay. Then we look at the dentition, and then we look at the ossification of bones. Okay. So putting all this together will give us an accurate estimation of the age. Please understand this. I'm calling this as age estimation. It will always be an estimation. So there will be a higher limit and there will be a lower limit. It is not possible via these features to fix the age. Meaning you cannot give a perfect one single answer for age using these criteria. It is not possible. Okay, it will always be an estimate, but you can make the estimate accurate by combining all these features, and that is what we do on a regular basis. Okay, so next we'll move into secondary sexual characteristics. What is meant by this? So sexual characteristics which appear at the time of puberty, they are termed as secondary sexual characteristics. So that includes development of breast, development of axillary hair, development of pubic hair, development of the genitalia. Okay, so this is common in common to the female sex. If you're talking about men, the development of axillary hair, including the pubic hair, and the development of external genitalia, these form a part of the secondary sexual characteristics. Okay, see, genitalia will be present from birth, but they undergo development at the time of puberty. So this development becomes a secondary sexual change. Okay, and so if you see the distribution of hair, so pubic hair development is indicated especially in the female as well as the breast, and in the male, the development of beard, the development of hair around the chest area, around the umbilicus, the pubis, as well as around the external genitalia. All this becomes part of the secondary sexual characteristics. Okay. So adolescence is the period between appearance of secondary sexual characteristics and their maturation to the adult form. So this is what the law defines it as. So adolescence is a period between the appearance of the first secondary sexual characteristic and the complete maturation to the adult form. So this time period is declared as adolescence. Usually it is between 13 and 18 years. So 18 years the person is considered as a complete adult generally. Okay. So this 13 is an average number, meaning 13 is usually the average age at which the secondary sexual characteristics start appearing. And this is very important in the case of sexual offense cases. Most of the time the perpetrator does not disclose the age. So in those circumstances, it is very important to estimate the age, and when age estimation is done on such perpetrators, we take into account the secondary sexual characteristics, and this gives us a fair idea whether the age is less than 18 or it could be more than 18. Yeah. So Tanner staging is used for estimation of age using the secondary sexual characteristics. See, Tanner staging is not very accurate, but these are found its way up time and again in the entrance questions. So mnemonic is very helpful here. First, I will go through the changes and then we can correlate the mnemonic. Okay. So Tanner has divided the secondary sexual changes in the female into 5 categories. Okay. So how has he divided? He's based it on development of the breast as well as the pubic hair. Okay. So grade 1 Stanner means there is no glandular tissue, meaning there will be only pinpointed nipples present in the first stage. In stage 2, breast bud forms. So a bud forms and there is a little bit of thickening around the nipple that forms the breast bud, and there is presence of small glandular tissue and areola wands, meaning it becomes larger in size. Okay. Next, breast undergoes elevation. So here it is flat. The breast mound is flat, and here it starts elevating. So breast undergoes elevation in stage 3 and extends beyond the borders of the areola. Okay, so the breast mound extends beyond the borders of the areola. So here you can see the elevation being explained. Here it is almost flat, and here it undergoes elevation. Okay. Next, areola as well as the papilla undergoes secondary mound, meaning areola forms a secondary mound around it. There is both increasing size as well as elevation. So areola and papilla undergoes development. The breast also comes forward and also it is elevated. Okay, this forms stage 4. Then finally the adult form of breast develops where the mounds are completely formed. There is a crease formed here and there is complete elevation of the breast to match the adult size. So this becomes stage 5. Okay. So if you are looking at pubic hair development, stage 1 pubic, there is no hair. Stage 2, there is small amount of hair present. There is small amount of hair. Stage 3 will be coarse and curly hair. So here you can't make out the hair. It is just a very small amount. It is usually straight. But as the hair extends, as the hair grows outwards, it becomes more coarse and curly. So this is stage 3. But see here, it extends little laterally, but does not extend into the thighs. Okay, there is no extension into the thighs. Stage 4 here, the hairs are more adult-like. That means they become more coarser, more dense, and there may be spare extension into the thighs. So hair starts growing sides like this. It may extend into the thighs a little bit. And finally, in stage 5, in adult form, it will be found even in the thighs. So this is the pubic hair development. So combining these two, the breast development and the pubic hair development, so Tanner has staged it. So stage 1, it will be around 13, and by the time adult form comes, it is usually around 18. This is the inference. So if you have to remember this, so there's a mnemonic: nobody elevates 2 mountains in an adulthood. No means no glandular tissue. Elevation means elevation of the breast. 2 mountains meaning secondary mound formation. That is this. And adult shape will be the final size of the breast. So for the mnemonic pertaining to the pubic hair, she is not a small cat. So no hair, small hair, coarse curly hair, adult-like, and the thighs. So this is an easier mnemonic to remember the breast and the pubic hair changes in the female form. So in the males, it is based on development of the genitalia as well as the testis. Okay. So for stage 1 will be prepubertal. Here the testicular size is less than 4 cc. So size, the testis size is measured by immobilizing the testis and using a caliper. Okay. So testis size is less than 4 cc and in volume, and 2.5 centimeter will be the longest dimension. Stage 2, here the enlargement of the scrotum and the testis. Here there is scrotum is not enlarged, it is same as the fetal form. At stage 2, the scrotum starts enlarging, testis and scrotal screen becomes reddened and changes in texture. Growth of the testis to 4 cc or greater in volume. So here it is less than 4. So at stage 2, it becomes more than 4 cc. Stage 3, the enlargement of the penis, that is the length at first and then further growth of the testis. So penis starts enlarging in the third stage. Stage 4 will be increase in size of the penis with growth in the breadth and development of the glans. So here the glans does not undergo changes. Here the glans starts increasing in the width. Okay. And stage 5 will be the adult genitalia. So this is how the staging is done in the case of males. So this is standard staging in terms of males. So again, same thing here, 13 to 18 years. So prepubertal, then enlargement of the scrotum, then enlargement of the penis, then enlargement of the glans, and then the adult genitalia. This is to summarize the changes in brief. Next, we will move on to odontology. Okay, more specifically, forensic odontology. So teeth development follows a particular order, and this is very helpful in determining the age from dentition. Okay, so just to give you a brief anatomy of the dentition. Okay, so teeth is roughly divided into 3 parts. So what is seen outside will be the crown. The junction of the crown with the root will be the neck. This is at the level of gums. And then what is not seen will be the root. Okay. So the outermost covering of the teeth will be called the enamel. Below the enamel we have dentine, and then below the dentine we have the pulp cavity. So this pulp cavity runs across the dentition here. Okay. So this pulp cavity gives the nourishment for the rest of the tooth. So all the blood vessels and the nerves, they run in the pulp cavity here. And the pulp cavity, when it extends down, they form a canal that is called as the root canal. So these form the root, and this enters into the subcutaneous tissue, and then from there the blood vessel and the blood undergoes the blood enters the vessels and leaves the tooth. Okay, so estimation of age from teeth is based on state of development and the secondary changes. So secondary changes gives us the advanced age, state of development gives us the initial age. So developmentally, teeth are divided into 2 types. One is called as the temporary dentition, and the other one is called as the permanent dentition. Temporary dentition appear first. Why they are called temporary? Because they fall off, and in their place you get the permanent dentition, which should remain the entirety of your life. So temporary dentition development takes place as follows. Okay, so the characteristics of temporary dentition I am explaining with the slide. Okay, so usually they are 20 in number. Okay, to start with, they are also called as deciduous teeth. Why deciduous? Also called as milk teeth, because they are the primary function of temporary dentition is to aid in suckling. So they are all the other name for deciduous. The other name for temporary dentition is also called as the milk teeth. Okay, total number will always be 20. They are usually smaller, lighter, and narrower. So this is in comparison with the permanent dentition. So they are small, lighter, narrow. Anterior teeth are vertical. So when you're talking about anterior teeth, it refers to the incisors. Okay, so the temporary incisors are more or less vertical, and the color of the dentition will be china white in color. The teeth are more divergent. The molars of the temporary dentition are more divergent. Okay, so these are the characteristics. Okay, so if you count the teeth, the easiest way will be one quadrant. If you count the quadrant, so this will be the incisor, canine, and the molars. Okay, so this will be how the temporary dentition is arranged. So if you look at the temporary dentition, how they erupt. Okay, so for eruption, see, next I'll be talking about eruption of teeth, then comes eruption of bones. So there'll be a lot of numbers. What I would like you to focus will be uh, the average ages when they appear. Okay, so that is an easier way to remember. That's why I'm stressing on. Just try to remember the average ages when they appear. You will be able to solve the questions quite easily. Okay. See, in central incisor, when it comes to temporary dentition, central incisor, the lower and upper show some variation in eruption. Okay, what are they? So lower central incisors, they appear between 6 to 8 months. Okay, so there are two in number. They appear between 6 to 8 months. Whereas the upper incisors, they appear between 7 and 9 months. So an important thing to remember here is the jaw is odontulous, meaning there is no teeth before 6 months of age. So this months I am telling after birth. So after birth, at 6 months of age, you get the first teeth, and the first teeth ever to appear in the jaw will be the lower central incisor. Okay. The upper central incisor are 4 in number. Then comes the lateral incisor. Here again there is a variation. The upper appears first, that is at 7 to 9 months, and then the lower lateral incisor appears at 10 to 12 months. Okay, so these are the upper are 6, lower are 8. Then comes the first molar at 12 to 14 months, that's 12. And canine comes at 17 to 18 months, and finally the second molar temporary appears at 20 to 30 months, that is 2 to 2.5 years. So from 6 months of age to 2.5 years, this is the time period when the temporary dentition comes into picture. Okay, and an important thing to note here is in the central incisor, the lower central incisor appears before the upper central incisor, whereas it is reverse in the lateral incisor. The upper lateral incisor appears before the lower lateral incisor. Okay, so here same thing I have depicted pictorially in this picture here. Okay, so these are all the temporary teeth. If you're looking at permanent dentition, okay, so permanent dentition will go in order when the teeth appears. So the first permanent teeth to appear will be the first molar. It is indicated here. It appears at 6 to 7 years. Okay. Then which tooth follows? Then comes the central incisor. So central incisor appears at 6 to 8 years. This is followed by the lateral incisor, 7 to 9 years. Then after the lateral incisor, look at the chart. Then comes the first premolar, 9 to 10 years. Then comes second premolar, 10 to 11 years. Then comes the canine, 11 to 12. Finally, the second molar, 10 to 14. And then to conclude, the wisdom tooth or the third molar is 17 to 25. Okay. Here what is to be remembered? So the first tooth to appear, first permanent tooth to appear will be the first molar at 6 to 7 years. And the last tooth to appear will always be the third molar, which is 17 to 25. This 17 to 25 is a very wide range. No other dentition in the permanent space has such a wide range. Okay, so this is quite important. So mixed dentition. When does a person have mixed dentition? Mixed means temporary and permanent present together. Okay, so this age, please everyone remember this age, between 6 to 12 years, every individual will have mixed dentition. How? So the mixed dentition forms within the alveolar cavity. So the tooth first forms in the alveolar cavity. It pushes the the temporary dentation out, and in that place the permanent tooth will then erupt. Okay, so if you see the ages also, the tooth starts developing from below, and the above tooth will not fall off the minute the permanent dentition starts developing. No, the permanent dentition starts developing within the alveolar processes. So these are the permanent dentition. Once they start developing in the root, as they grow in size only, they start pushing the deciduous or the temporary teeth above them, and this tooth will fall off. Okay, so this goes same for all the dentition, all the temporary dentition. So wherever temporary tooth are there, its permanent precursor appears in the alveolar cavity below, and when the alveolar cavity, the permanent dentition starts increasing in size, the temporary dentition will fall off. So a person will have mixed dentition between 6 to 12 years of age. Next, we see what is successional teeth and what is superadded teeth. So what is meant by successional tooth? So successional teeth erupt in the place of deciduous or temporary teeth. Okay. So successional tooth are nothing but all the temporary dentition. Why? Because all these temporary dentition have a permanent precursor. So the permanent tooth grows from below and dislodges that temporary dentition. Okay. So successional tooth are those permanent tooth which are replacing the temporary dentition. So if you look at the jaw, the incisors, the canines, and the premolars are called as the successional tooths. So incisors, canines, and premolars. These are called successional tooths. Why? They have a temporary precursor, and those temporary dentition are dislodged by these permanent tooth. Okay, so they're called a successional tooth. What is meant by super added teeth? They do not have a deciduous precursor, meaning they are separately present in the jaw. They are not dislodging any temporary dentition. They appear independently within the jaw. Okay, so these are nothing but the molars. The first, second, and the third molars, they are called as super added. Why? Because the jaw has to grow and then make space for this dentition to come. That is why people have difficulties with the formation of the third molar also. If the jaw is long enough, the body of the mandible is long enough only, there will be space for the third dentition. Otherwise, most of the time it gets impacted. So that is one of the reasons. Okay. So this Boyd's formula is nothing but the incremental lines which are found in the dentine and the enamel. Okay, what are these? So this Boyd's formula is only useful for children less than 1 year of age. So less than 1 year only it is useful. Why? See, these incremental lines, they start developing in the teeth the minute the baby is born. So each day one line is added and the lines go on extending outwards. So if you want to find the age of the tooth, you can count the number of lines and we can come to the age conclusion. But for this, you have to take the cross section of tooth. So what is implied here is this is possible only when the person is dead, only when the fetus is dead, or only when the newborn is dead. We can extract the tooth, take a cross section and count the incremental lines and give the result. And it is useful only up to 1 year. Beyond 1 year, this method becomes irrelevant or unreliable. Okay. Stack's method is a method again up to 2 years of age. There are tables with height and weight of each tooth. So if you take a teeth, measure its height and weight, using the table we can calculate the age of the tooth as well as the age of the person. Okay, so these two are available on, it is available only for pediatric age group, not for adults. Okay, please keep that in mind. So Boyd and Stack are usually used for pediatric age group. So this is the X-ray we take. This is in the living. So if you have to assess the age of a living individual, so we can do an orthophantomogram. This is nothing but X-ray of the mouth and the mandible. So if we take an X-ray, so the entire teeth is represented flat like this. Okay, so we can make out. So there are central incisor, lateral incisors. There's a the premolars are here, and there's a molar tooth. So we can count the tooth and can comment on the age. So this is for the living. So this is called as the orthopantomogram. If you have to take one independent tooth, then there is a type of X-ray called as the intraoral periapical radiograph, or IOPAR. Okay, here you can clearly see that there is a permanent dentition below, there's a temporary dentition above, and it is pushing the temporary dentition out. And you can see here, this is the first molar tooth. This does not have any temporary dentition above it. It comes independently from the root. Okay, so this is an intraoral periapical radiograph. Okay, this is the first question. So the permanent first molar erupts at what age? Yes, students, answer. Anyone present? Okay, I'll continue with this. No problem. You can join in anytime. So first permanent molar, I've described this. This appears at 6 to 7 years of age. This is the first permanent tooth to erupt. Okay. So this is a table just to show you at what age each tooth erupts. So first molar is the first tooth to erupt. It is at 6 to 7 years. Okay. 7 to 9 will be the lateral incisor. 9 to 11 will be the first premolar, and 11 to 15 there is no age group specified in the chart, but you can take canine as the closest approximate for that. Permanent second molar erupts at what age? So permanent second molar erupts usually at 12 years of age group. Okay. So this is again the chart. You can see that second molar, that is the question. It appears between 12 and 14 years. Always this range is important, because they can ask 12 as an option or 14 also as an option. So depending on what they have asked, you have to make a choice. Age estimation is done best by examination of what? So in the given options, pubic hair is not very reliable. Dental X-ray is there. Yes, this can be done. X-ray of mandible is also there, but mandible you don't have any secondary centers to use for age estimation. Eyes cannot be used. So dental X-ray is the best option. Pubic hair is not very reliable. Okay, so if you say pubic hair, then it will usually be the Tanner staging. So Tanner staging is not very reliable method. So out of the 4 options provided, the best option would be the dental X-ray. Okay, so next we'll step into the secondary changes within the tooth. So Gustafson method is one where age estimation can be done after 25 years. Before 25 years, these changes are not available in the dentition. So all the secondary changes within the permanent tooth, they take place after 25 years of age. So various criteria of physiological changes are present. They are both macroscopic and microscopic changes, and they are applicable for dead individuals. Please understand this. Why? Because most of these criteria, if you have to study the microscopy, you have to remove the teeth. That means you cannot do it in the living individuals. Okay, but there are 2 criteria within this Gustafson's method which can be applied to living people. That is the attrition and the parodontosis. Okay, please note, this is for living individuals. Whereas the other criteria, this is the mnemonic to remember this, APSRTC. So attrition and parodontosis is for the living, but all of them can be applied for the dead. Okay, so if the question comes like, which are the 2 criteria in Gustafson's method which is useful in the living, it will be attrition and parodontosis, but all of the 6 criteria can be applied in the dead individual also. Okay, so what are the 6 criteria? 1 is attrition, 2 is parodontosis, 3 is secondary dentine, then 4 will be cementum opposition, 5 will be root resorption, and 6 will be transparency of the root. Okay, so secondary dentine, this is a secondary dentine deposition within the tooth. Secondary dentine here, appears here. Cementum apposition, so the gums start becoming loose, the gap starts developing here, that will be cementum apposition. Root resorption, so the root goes on. If you see this bone, the root starts, the teeth starts moving upwards, the root starts developing space here, so that will be root resorption. And transparency of the root, there will be mineralization within the root here, therefore they become more and more transparent as age progresses. Please remember this transparency of root because it is the most reliable method. They also use what is called as a Mills method to assess the transparency of the root. So here what they do is they grind the tooth to about 1 millimeter thickness, and dots are used. So if the dots are visible, the number of dots are counted, and there's a chart to calculate the age. Okay, so transparency of root when it comes to dentition, that is the most reliable method for the estimation of age using the Gustafson method. Okay, so what is done here just to depict how the changes progress. So attrition is loss of the enamel due to wear and tear. So this goes on occurring beyond 25 years, quite measurable. A0 is no change, A1 will be slight change extending only into enamel, A2 extends into the dentine, A3 extends into the root. So similarly, all changes are given grading from A0, A1, A2 and A3. Okay, so secondary dentine is graded in a similar fashion. So finally, if you see in third stage, APSRTC, how it looks. So A completely into the root, there is complete secondary deposition, secondary dentine deposition. Then periodontosis, this is the gum line is completely receded. Then cementum is formed on either side of the root here. Then the root is completely transparent, and resorption, the root is here whereas the teeth is here, so there is a large space here. Okay, so this will be the root resorption. So the points are given for each of them. Total score is calculated by adding up all the points, and age in years is obtained by this formula, 11.43 plus 4.3 into the total score obtained here. Okay, so that will be the age in years. So questions here. Among secondary changes in the tooth, the most useful for age determination is, so already answered this, it will be the transparency of the root. And what method is used here? It is called as the Mills method. Okay, next we move into osteology. Okay, just to give you a brief idea of how ossification occurs in the bone and what are we looking at. We are looking at secondary ossification centers. These are very important. Okay, what is the distinction? Okay, so there are primary centers within the bone, and then the secondary centers which appear later on in life that give the form to the bone. This is a primary center. What? It's a cartilaginous model. Then after the cartilage, there's a periosteum formation on either side. So cartilage becomes calcified inside here. Then there is compact bone development, meaning there is continuous mineralization and new bone formation continues, and compact bone, that is the hard bone, is formed here. Primary ossification center appears now within the bone. Okay, then blood vessels also enter from the outside. So you have the Haversian system, through that the blood enters into the bone as well as the ossification centers. Okay, so once the primary ossification center is there, as the bone starts elongating, as it becomes bigger in size, the ends of the bone, the growing ends of the bone are called the epiphysis. So at the epiphysis, you have the secondary center formation. This is a femur bone. This is a femur bone. So I'm explaining the secondary centers within the femur. Okay, so there is a center for the head of the femur. Then there are two centers for the greater and lesser trochanter, and then there's a center for the lower end of the femur. Okay, so these secondary centers develop, they give the characteristics of the bone, and they finally fuse with the body of the bone. Okay, so it has been observed that there is a definite pattern to the appearance of these secondary centers and the time at which they ossify with the main bone. Okay, so if you look at the adult bone, this is how the adult bone looks. So there is the head of the femur here. So this could be the greater trochanter. This would be the lower end, which articulates in the knee. And there is a marrow formation here. This would be the body of the femur here. So the contours of the bone are determined by the secondary centers, and we are worried about when they appear and when they fuse. That is what gives us the age. Process of appearance and union of ossification center has a sequence and time period. Okay, so there is a definite sequence and there's a definite time period at which it occurs. Aging of bones is more accurate with respect to appearance of centers than union. So appearance is more accurate compared to union. Okay, so please keep this in mind. So we'll move to skeletal remains now. So please don't be alarmed by this big table. So these are all the bones which are of medical legal importance, and their appearance and fusion is indicated here. What I would like you to do here is broadly remember when most of them appear and when most of them fuse. Okay, so if you're looking at this sternum, so there's a center for manubrium, first, second, third, fourth, and then the xiphisternum. So these all appear, please remember this, they all appear in intrauterine life. Okay, so 5th month to 10th month of intrauterine life, you have the development of the different centers within the sternum, and xiphisternum appears in the 3rd year of postnatal. So this appears after birth. So xiphisternum appears after birth, whereas all the other centers appear in the before birth, that is in the intrauterine life. But look at when they fuse. Xiphisternum is almost fusing at 40 to 45 years, whereas the manubriosternal joint fuses at 60 to 70 years. Okay, so these are things to remember. Clavicle, again medial end, there is only one center here, appears at 15 to 17 and fuses at 20 to 22. Okay, scapula, not very important, but just to give you coracoid and acromion process, coracoid and acromion process. Coracoid appears 10 to 11 and fuses 14 to 15. Acromion fuses, appears exactly when coracoid fuses. Okay, so acromion appears at 14 to 15 and fuses at 17 to 18 years. Okay, so in the lower limbs, humerus, the head of the humor appears at 1 year. So there is a sequence here, 1, 3, and 5. Okay, head, greater, and lesser tubercle, 1, 3, and 5 years. All of them, they fuse with the 3 fuses together to form a conjoint epiphysis. So these 3 fuse together to form a conjoint epiphysis at 5 to 6 years, and at 17 to 18 years fuses with the shaft. Okay, so 17 to 18 years fuses with the shaft. Capitulum again appears at 1 year. Trochlea between 9 to 10 years. Lateral and medial epicondyle 10 to 11 and 5 to 6 years. Okay, so here capitulum, trochlea, lateral epicondyle, they form the conjoint epiphysis again. Okay, so continuing. Radius, upper end appears at 5 to 6 years, fuses between 15 to 17 years. Lower end appears at 1 to 2 years, fuses with 17 to 19 years. Then ulna again follows with the radius, but it appears a little after the radius. So upper end of ulna 8 to 9 years, lower end is 5 to 6 years. Fusion of the upper end of ulna occurs at 15 to 17 years and lower end at 17 to 19. Then carpal bones, especially the pisiform, it does only appearance, it is at 9 to 12 years. In the hip bone, what is very important, it will be the iliac crest and ischial tuberosity, because they appear, iliac crest appears at 15 to 16 years, ischial tuberosity 16 to 17 years. See, please remember this, ischial tuberosity will be the last to fuse in the hip bone. It fuses between 20 to 22. Fuses between 20 to 22 years. So by 22 years, all the things are fused in the hip bone. But age of the hip bone can be estimated by other methods beyond 20 years also. I will talk about it later. Fine. Femur, head of the femur. Here in femur, what is most important is, please remember this, lower end of the femur appears at 9 months of intrauterine life. Why I am stressing on this? See, it says 9 months. If we see the lower end of femur either on X-ray or direct examination, if the lower end has come, then the fetus is automatically viable because it has crossed 9 months. If the lower end is not there, then we have to look at other centers. Okay, Which are the other centers? They are in the tarsal bones. So we have to look at calcaneum. Calcaneum appears at 5 months of intrauterine life. Talus is at 7 months, and then cuboid is again at 9 months of intrauterine life. So if talus has appeared, then the fetus has crossed the viability, because talus appears at 7 months of intrauterine life. Okay. Another way to determine will be the lower end of femur. So if lower end of femur is also directly present, see, because talus is, you have to dissect and look at the talus. Okay, the talus bone, you have to do a lot of dissection. Lower end of the femur is much more easier to dissect compared to the talus, because talus you have to cross the entire foot, dissect the entire foot, and go for it. Lower end of femur, either you can use an X-ray or you can do direct dissection in the case of dead individual. If the lower end of femur is already present, then we can conclude that the fetus is viable. Okay, continuing. If you look at the head of the femur appears at 1 year, greater trochanter at 4 years, lesser trochanter at 14 years. Then fusion, 17 to 18 years will be the head, 14 to 15, 15 to 17 will be the greater and lesser trochanter. And see the lower end, so it appears first, but it is fusing the last at 17 to 18 years. Okay. Tibia, fibula, you can read it up, not very important. So there's an acronym to remember here. Ossification and fusion occurs towards the knee, and away from elbow. Please remember this. So ossification occurs towards the knee and away from the elbow. What do you mean by towards the knee? Meaning the ossification starts away from the knee and proceeds towards the knee. What do you mean by away from the elbow? Meaning elbow fuses first and then rest of the joints fuse in the upper limb. So in the lower limb, the hip and the ankle fuse first, and then it extends, the knee will be the last to fuse. Whereas if you look at the upper limb, the elbow will be the first to fuse, then the shoulder and the wrist joint, they fuse later. Okay, so this is one acronym you can easily remember and use it in entrance. Okay, which ossification center is useful for determination of age below 18 years? So if you look at the options are lower end of femur, lower end of humerus, upper end of humerus, and upper end of tibia. You have just read it. So the best answer will be lower end of humerus, because it occurs at, just look at this table. So lower end of humerus, if you see, the lower end of humerus fuses between 17 and 18 years. Okay, so they have asked what is the best criteria to determine age below 18 years. So the best answer will be lower end of humerus. Okay, next, center for ossification of which of the following is used as medical legal evidence of fetal viability? I've already answered this. You should be knowing it is the distal end or the lower end of femur. Why? It appears at 9 months of intrauterine life. Okay, so greater trochanter, lesser trochanter, head of the femur occurs after the fetus is born and beyond 1 year, whereas the lower end of femur appears at intrauterine life 9 months. So that indicates the fetus is viable. Okay, calcification of costochondral cartilage is at dash years. Okay, so here what we need to remember, so the laryngeal cartilage, the costal cartilage, the hyoid bone, and the xiphoid uniting with the sternum all take place between 35 to 50 years. Okay, so it's a point to be noted. 35 to 50 years, laryngeal cartilage, costal cartilage, hyoid bone, and xiphoid uniting with the sternum. So here when I'm talking about the cartilage, it is the calcification of the laryngeal cartilage, calcification of costal cartilage, calcification and uniting of the hyoid bone with its ends, and xiphoid uniting with the sternum. All of this take place between 35 to 50 years, average age of 40 years. Sometimes they give only 40, sometimes they give 35 to 50 years. So the best answer will be 35 to 50 years. Medial end of the clavicle fuses at, this was indicated, this will be 18 to 22 years. So the asked fusion appears is around 13 to 14 years. Fusion is 18 to 22. So it fuses at 21 years. So the closest option to 21 will be 18 to 22 years. That will be the fourth option. So for the carpal bones, it is easier to remember the appearance using the diagram here. How? So it goes on like this in an anti-clockwise fashion. First will be the capitate. So this is at second month. This is afterlife, please remember. Then comes the hamate, which is third to fourth month. Then comes the triquetral. See, triquetral is indicated here, 3 years. Tri, 3. So this is easier to remember. So the name itself has tri in it, so it appears at 3 years. Then lunate appears next to it at 4 years. Then scaphoid, that 5 years. Trapezium, trapezoid, both you can take this. It is roughly around 6 years. So this is trapezium is 6 years and trapezoid is 6 to 7 years. Then finally, the last carpal bone to appear will be the pisiform at 9 to 12 years. So skull sutures, briefly addressing them. In a newborn skull, you have one additional suture called as the metopic suture. Metopic suture is present between the frontal bones. So metopic suture obliteration takes place at 2 to 4 years. Before that only, the anterior fontanelle goes, the obliteration occurs. So anterior fontanelle is present between the coronal suture, sagittal suture and the metopic suture. So there's a diamond shaped space. So this will be the anterior fontanelle. It obliterates at 1.5 to 2 years. Then we have the sagittal suture between the two parietal bones. Then posterior fontanelle between the sagittal suture and the lambdoid suture. So that fuses at birth or at 6 months of age. Okay. Then we have the occipital bone. Occipital, we have lambdoid suture between the parietal and the occipital bones. Okay. So when does suture fusion occur? Very easy to remember. How? Only in the sagittal suture we have 3 parts. Rest all are, the coronal has 2 parts, rest all have one part. So if you have to look at the first suture which fuses in the adult skull, please remember this. Okay. The question is something like, which is the first suture to fuse within the skull? So ideally the answer will be the metopic suture. Okay. So the best answer will be metopic suture. Why? Because it is a suture between the frontal bones. See the age of fusion, it is between 2 to 4 years. This will be the best option. After metopic, if you have to look at the next suture which fuses in sequence, so that will be the basi-occiput and basi-sphenoid, which is occurring at 20 to 22 years. Some books give 18 to 20, some books give 20 to 22. Average age of 20 can be taken. Okay, so the basi-occiput, basi-sphenoid fusion occurs at 20 to 22 years. So this is visualized at the base of the skull. So these are parts of the one is part of the occipital bone and one is part of the sphenoid bone. So where the occipital bone meets the sphenoid bone, that is where the suture runs. It is very small and that obliterates at 20 to 22 years. Okay, so after that in sequence, if you have to go, the next will be the sagittal suture. So sagittal suture, posterior 1/3 fuses 30 to 40. Then the anterior 1/3 fuses 40 to 50, and the middle 1/3 fuses between 50 and 60. Similarly, coronal suture is divided into 2 halves, and each of the half is divided into 2 parts, meaning right half, left half. So right half again is divided into 2 parts. So the lower right half fuses at 40 to 50, upper right half fuses at 50 to 60. Similarly, the left half also fuses. Okay. Then comes the lambdoid suture. So this will be the lambdoid suture here. So average age of fusion of lambdoid suture is roughly around 45 years. It's indicated here. So average age can be taken as 45 years. So the lambdoid undergoes fusion at 45 years. Okay. Finally, there are 2 areas where multiple sutures meet. One is called as the pterion. So the pterion is formed. Above we have the coronal suture. This is the sphenopalatine suture here. Then the Coronal suture is extending down here. So there's a third suture here. So these three areas, we are not worried about this suture. We're more worried about the spinopalatine meeting the coronal. So junction of this forms the pterion. So this will be the zygomatic. Sorry, this will be the zygomatic bone. So palatozygomatic suture is here. So the junction of all these four sutures form the pterion. Pterion becomes one single area at 50 to 60 years. So this completely becomes bone. So this junction becomes bone at 50 to 60 years. Similarly, we have asterion. We just asterion, Asterion, asterion. So asterion is meeting of the lambdoid with the spinopalatine and the yes, with the spinopalatine suture. So lambdoid meeting the spinopalatine suture. So that becomes bone at 60 to 70 years. And the last suture to obliterate in the skull will be the spinopalatine suture. This is at 80 years. Okay. So the maximum age determined from the skull can be taken as 18 years, 80 years. Okay. So that is the important thing to remember. So if you see what all age groups can be determined from the skull. So we can start with the dentition. So the first dentition is roughly around 6 months of age. And the age can go all the way till 80 years. So there are different ossification centers. So skull is very, very important for age determination. So looking at sutures, coronal suture completely fuses at. So they usually it is the range which is given, but here one age group they have given. Please approximate to the nearest age group. So coronal suture completely fuses. So they are asking lower as well as the upper half. So lower half is 40 to 50, upper half is 50 to 60. I'm saying a right half. So the right half completely fuses at 60 years. So 60 will be the best option. Similarly, the left half also fuses the similar manner. So if you see the total coronal suture, it completely becomes bone at 60 years. Closure of skull sutures indicate that age is more than, so if all the skull sutures are closed, so it will be more than 80 years. That will be the option. Best bone to assess age between 25 to 50 years. So this is how they usually ask. So they'll give you an age range. So you have to remember the centers and when they appear, when they fuse, to give the answer for this. So best bone to assess age between 25 to 50 years. So already I have given the answer. So it will be the skull. So from 6 months to all the way till 80 years, you can use the skull. Okay. Ribs are not very reliable. Sternum is not very reliable. Symphysis pubis is also not very reliable. Okay. So another thing I want to tell here is a concept called as lapsed union. LAPACD, lapsed union. What is this? I'll go back to the skull. So I've told these sutures, I've informed this. So this is the usual order the sutures follow to fuse. But sometimes some suture will not fuse. For example, sagittal suture middle may not fuse. The spinopalatine is fused, but the middle 1/3 of the sagittal suture is not fused. Technically, this has to fuse, and then spinopalatine suture has to fuse. But if this is not fusing, that is termed as lapsed union. What is the meaning of that? So sometimes the suture fusion does not occur in chronological order. They remain unfused till death. Okay. So lapsed union is very, very common in the central skeleton, especially the sagittal suture. So sagittal suture is one suture in the skull which generally exhibits lapsed union. Okay. You will see these are defects within the bone. You will see that the suture is present even though all other sutures are obliterated, meaning all other sutures have turned into bone except this sagittal suture which is still remaining. So that it may lead to confusion, but actually what has happened is the lapsed union. Lapsed union is very common in this axial skeleton, meaning the skeleton which is in the central part of the body. Skull is in the center. Yes, within the skull, again within the center, we have the sagittal suture, which is a common bone to show lapsed union. Okay. Age changes in the mandible. In brief, let us go through this. So here, what is to be kept in mind is the position of the mental foramen. Okay, so the mental foramen is almost in the middle in the adult age group. This is infant, adult, and old age. Okay, so very easy to remember this. In the infant, the mental foramen is somewhere closer to the lower margin. It's not indicated in the bone. Okay, so you can see here. So the mental foramen is closer to the lower margin in an infant mandible, whereas if it is in the adult, it will almost be in the center, in the middle. What middle am I saying? So if you look at the entire width of the body of the mandible, this is the body of the mandible. Okay, so this is the dentition present. This is the upper margin. This will be the lower margin. So if you divide this distance, the mental foramen is always in the middle. Okay, so this indicates adult age, and in the old age, it comes more towards the dental margin. Okay, that is the upper margin. Okay, this is a rough way to divide the mandible into infant, adult, and old age. Okay, now we'll look at some changes which occur within the symphysis pubis. So I'm talking about symphysial end of symphysis pubis, meaning the symphysis is like this. The symphysis is like this. So this is one symphysial bone and this is the other symphysial bone. So we divide the symphysis. So this is possible only in dead individuals. We divide the symphysis bones like this, and we study this surface. Okay, so this is the meeting surface of the both symphysis bones. So this is one symphysis bone, and there are changes within the symphysial surface of symphysis pubis. So this has been studied. So who has studied this? This was studied by Todd, McKern, and Stewart. So this is called as the Todd, McKern, and Stewart criteria. Not very important. Just try to see what ages they present. So bones are roughly divided, the age groups are roughly divided into 10 years age group. Okay, so one change is at 20, one change is 20 to 25, the other is at 30 to 35, 35 to 45, and then at 50 years. So I told you the last center to fuse within the hip bone will be the ischial tuberosity. It fuses between 21 and 20 to 21 years. So beyond 20 years, what criteria is used in the hip bone? That will be the Todd, McKern, and Stewart criteria. So less than 20 years, there is compact bone near its surface. So there are compact bone near the surface of the symphysis. Okay, about 20 years, surface is marked irregularly uneven. Ridges run transverse across the articular surface. So this is the articular surface. Sorry. These are the articular surfaces. These are the ridges running across the surface of the symphysis. Then 25 to 40 years, the ridges gradually disappear. So you can see that the ridges are gradually disappearing. Okay, surface has granular appearance, so there are grainy appearance, and outer and inner margins completely defined. So there is a margin definition which is being seen. So you can see the double line is there here. So outer inner margins are developed between 25 to 40. So this change is seen gradually till this 40 years. Okay, 40 plus, what happens? Oval smooth surface with raised upper and lower ends. So at 40 years, so oval smooth surface, there is an oval surface here with raised upper and lower ends. Okay, 50 plus, erosion of the surface and breakdown of the ventral margins. So the margins here are completely gone. Here you can see some amount of margin present, but in this 50 plus age group, the margins are completely broken. This was a one margin which is complete. This is broken here, this particular area, and the surface is completely eroded. This becomes uneven. Okay, it is the single best criterion for determination of age at death for individuals from 3rd to 5th decade. So from 3rd to 5th decade, so 30 to 50 years, Todd, McKern, and Stewart is the best criteria for assessment. So this is how the bones look, and you can see the changes. There's ridges here, then there's a margin formation here, margins become more. Okay, and then margins start disappearing. There is erosion of the bone here, bones are completely eroded. There is no margin here. At least you can see some margin present, but there is no margin. So this is around 20 years. Changes are occurring 20, 30, 40 years, and then this is at 50 years or plus. Okay, I think time is up. We'll stop here. Medical legal importance of age, I will take it up in the next session.